You've mentioned MCT oil and exogenous ketones throughout the conversation. Those and otherwise, let's talk about substances and supplements people want to consider when they're on this journey.
Well, that's a great question. So when I think of supplements or I think of additional consumption, I look at could the patient be getting this from their food? And then, of course, you'd love to see if that can happen. So when looking at a place where MCT, especially the chain of C8, 8 carbons and 10 carbons, those really have the best evidence for brain improvement. So I have lots of patients who are in that chapter like David was, where the ketones sunk. And what I need them to do to get their metabolism back and what they are able to do are not in the same space. When using a supplement, I think of it as a drug. Like it's delivering something that I can't get their body to do because the disease burden is too high right now. Just like if you came to me and said, my blood pressure is 200 over 100 for the last 3 years, I would probably start with a prescription medication. Especially in you, if seeing your body size, meaning the pill isn't forever, but it is to decrease the burden of what the disease is doing in real time until you can develop the behavior that that Jane has developed. Right? That's a lot of that. Some people are never going to be able to withstand that emotional change. So what MCT does is it is a long-acting delivery of ketones. It's what I use in my dementia patients or my Parkinson patients. I need their ketones to be at a certain level for a certain hours of the day in order to get the benefits of that mitophagy and autophagy. The fat chains do a better job of rising those ketones than anything else as far as the long term. I can do a much better tasting option in a ketone powder, and it is their liver doesn't have to do anything. They swallow the ketones and they pee out the ketones. The best part that I use the exogenous ketones for, and I use them myself from time to time. If I have an afternoon slump, I'm not fasting. I haven't been perfect, and I want to swallow the ketones. That I put it in bubble water and have a very sour tasting, like a lemony water is what it tastes like to me. Or in my other patients, I will use something that's got stevia in it, so it has a sweetness. Kind of depends on where their palate is in their journey. But what that does, ketones in circulation beget ketones. So that state of ketosis signals the liver mitochondria to make more ketones. So there is a therapeutic intervention that we use in cancer patients all the time, saying your chemo's tomorrow. I need these ketones higher. Please drink, 4 servings of the of the ketone supplement because I need that high before you go into chemo. I need it high when you're in the bariatric hyperbaric chamber. So those interventions are helpful medically. But when I look at the universe out there who's using them, if you are in the 200 club, the other thing I'm going to tell you to do is swallow ketones. That week where you're trying to cut down ketones, let your liver see what ketones look like before we ever cut your carbohydrates. I cannot tell you how much easier this transition is for somebody that's very metabolically asleep. I will wake them up with circulating ketones. I also know that when people fall off the wagon, it's usually their sweet tooth that gets them. And to add that ketone back, the longer those mitochondria go without seeing a ketone, the harder it is to resurrect. But let me tell you the other thing that's been on my supplement list in the world of helping people with broken metabolisms is the advent of the GLP-1 prescription drugs. And I came out pretty quickly saying, quit this. You don't, Byetta, which I've been writing prescriptions for since 2013, it was the first one, and we've seen them. And yes, there is an impact that was made on those earlier renditions of their appetite, but it was nothing like what these recent generations have been. But like any good scientist, I keep my ear to the rail of what science is showing us. And when you look at the microdosing of these hormones, adding these hormones to some of my severely insulin resistant patients that they have had the wave of ketones and then they sink. And they restrict and their ketone production is so tiny. And we can supplement, but we are also trying to lose weight. And the hormone they're really missing is GIP, GLP-1, and I contend the next one that's about to come out is the most powerful one. It probably won't hit till 2026 or maybe 2027. But these peptides, not in the doses that we're talking about, that would be for a diabetic or what we would have used them for in the regular zone of the clinic. It's fascinating to see how somebody who is really struggling to stay on the wagon, and you add the smallest amount of these incretin hormones, and these are gut-brain hormones that are so muted, Jesse. It's like they haven't heard them in a lifetime. And even in a ketogenic state, I get a window where they were feeling that benefit, and I've learned, okay, they have learned how to eat, they've learned how to cut carbs. This lifestyle is what I need them to learn if they want to be free from me. But there is also a part of their endocrine system that's so broken that the smallest whiff of them awakens a flood of what we're trying to get their body to do. And it's almost like that the prime of a pump, like this hormone was doing nothing. A micro dosing of it, and I'm talking like 1/10 of the dose that is a typical dose. So not only does that prescription last a long time, so the cost is much less to this patient, but they get to the end of like a 4-month time, and we say, well, I wonder how you would do without it. And it's remarkable that you have just awoken, you've just given CPR to a part of the endocrine system that dramatically changed how they feel satiety, how they have pleasure, and specifically how that brain is addressing concentration. I mean, brain function is what I'm talking about. They're going to be the biggest neuromodulator out there is the incretin class that's coming. And I contend you get the most power when you are on a bed of ketones. I also think it's giving them the most success of stopping them.
What's the name of this new compound that's coming?
So the original one was the Ozempic. The one that's out now. The second one was Mounjaro, which is tirzepatide. The one that's very exciting for me as a neuroscientist is the retatrutide. It's got 3 hormones involved in it. It's got a GLP-1, probably about 20% of what Ozempic had. It's got a GIP, and again, that's what Mounjaro's biggest second added hormone is. But it's got a third one, which is a glucagon agonist, and it's the neuromodulation. Like, I've been dealing with patients with addiction forever, right? And what it's doing for addiction is incredible. It is incredible. I'm so excited to be a physician in this time, and to have the platform that when you can take a metabolism they're really trying to resurrect what has happened to their mitochondria, but they need hormones. That's where the hormones are really powerful, right? And these peptides have just touched something that I'm super excited to see patients being free of what has been their shackle for decades.
Let's end on this. Somebody that follows the diet, the lifestyle we've been talking about, they're somewhere on that continuum of insulin resistant all the way to type 2 diabetic. If they apply this lifestyle, and obviously it's going to be different depending on the person, their genetics, how far down the line they are having metabolic dysfunction, but how quickly can they start to really turn this around?
Oh, they can have new mitochondria by day 4. That wave of ketones, you really do get to have a fresh set. And then every stimulus, you get a new set, and you get to add to the team of the healthy guys and let the older ones be replaced. When I look at the reversal of some of the most severe problems, it's not fast. We can get them feeling better. And I think there is nothing better than starting with their brain. This is why supplements I put those ketones on the block to say, get them drinking it. You have depression, just drink this. You can't believe how much changes. Then read a book, read something that shows you how much this shouldn't just be coming from a powder, but from the insides of your cells. And I think it's the steps that when I look at that discovery, I'll check in at 6 months. And if they're able to stay on that pathway, I mean, it's a different person in 6 months. And then how far do they want to push? When you're in a group that you get to the top of the, racket for you seem to be doing the best, just invite people into your group. Look at the next challenge for you. And I don't mean that life needs to keep getting harder. That's not how you see it. I think of more creative ways, more fun things that your health can do because of that metabolism. And that's a full life. So if I look at the life where they are trapped in their obesity, in their disability, and the restoration, I mean, a year gives us a full range of where I've just seen miracles happen. But I see people wake up within 3 weeks, and I see transformation in 6 weeks of, 40 pounds lost and prescriptions dropped. So that timeline depends, but instead of looking at how long do I have to, just how long until I get to have that. And then that's the reward of why we do this, of the health you have behind your purpose in life.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin is